Good morning, everyone. Thank you, Dr. Nabita. My name is Eunice Gathitu, as introduced, from the Ministry of Health, Department of Health Products and Technologies. So I'll take you through the policy direction towards local vaccine production, and it is a build-up of what our guest speaker took us through. So we'll just be adding to what he mentioned. Next slide. Yeah, so in terms of background, the government has put efforts so that we move towards production of vaccines locally. A lot of it is based on our challenges during COVID. And then we're also addressing the two of the presidential big four agenda, both universal health coverage and the local manufacturing. So we are building on that. And of course, Prof. Matilu mentioned about Kenya being weaned off Gavi support by 2027. So we need to look at sustainable ways of ensuring we have vaccines sufficient for the country. And then I'll also mention we have the HPT supply chain strategy, which is a 2020 to 2025 strategy. And in terms of vaccines, it looks at several aspects that we can build on again. Partnerships, which we are mentioning today, both public and private, availability of health products, including vaccines, production, financing, research and development. And in addition to that, we're also looking at what government incentives can be put in place to ensure that what is produced locally is affordable. Remember, you find sometimes we import medicines and other products and they end up being cheaper than what is available and produced in Kenya. So we need to look at incentives in general to ensure that for the local manufacturers, and we have so many for medicines, what are we putting in place to ensure that we are reducing the cost of production so that we ensure that affordability is guaranteed, which is part of what UHC aims to achieve. And then there's a committee that was instituted by MOH. It is multidisciplinary and multi-agency. So that was put in place in April 2021, and it's looking at how to move the agenda of putting up this manufacturing plant. So the committee has various institutions represented. There's MOH, KEMRI, KEVEVAPI is the Kenya Veterinary Vaccine Production Institute. So they do a lot of animal health vaccines production. The members from the AG's office, because of issues of the legal framework and environment. National Treasury, because of funding, Ministry of Defense, and Ministry of Internal Security. Remember, COVID is also a security issue. And then in terms of the role of the committee, so what they were tasked to ensure and work on was to assess and advise on the feasibility of COVID-19 vaccine production. So there's a feasibility report that was done in 2020, and it's guiding putting that plant in place. Then they also did they developed a concept note looking at the business case, the cost, what is required. They're also supposed to implement the establishment of the vaccine manufacturing plant and oversee the commissioning as well. Next slide. In terms of operationalization, so we are not starting from scratch, even as we look at human vaccines. So we want to borrow a lot of lessons from the, as I mentioned, KEVEVAPI, the Kenya Veterinary Vaccine Production Institute. They have been doing quite a number of vaccine production for animal health. Then the Kenya Biovax Institute Limited has been incorporated. Prof. Matilu mentioned that as well. And of course, the priority is COVID vaccine, but as a country, given that we need to have a long-term solution, we shall look also into other vaccines that we need for majority of the country. Then, of course, we also want to, there's need to look at sustainability, long-term sustainability and viability, and operational objectives. Again, given where we are as a continent, not many countries are producing human vaccines. And Prof mentioned that there are quite a number of countries, Senegal, Tunisia, and Egypt that are producing vaccines, and others have started processes, including Kenya, Ethiopia, Ghana, etc. So we need to look at what we can do as a region. Of course, not every country can produce all vaccines, but you can have bilateral and multilateral agreements such that we collaborate as a continent. Looking at other countries like Brazil, India, that have huge populations, and they're able to produce vaccines for their market and export to others. So we can borrow that for Africa and see how to work around that. Because vaccine production is quite costly. It is capital intensive. The return on investment is not immediate because there are a lot of things you need to put in place before you are able to even break even and see the gains of the inputs that you need. Next slide. Then in terms of the project implementation, so this project commenced in April 2021, and we are looking at doing it over 4 years in 3 phases. So phase 1 is planned to be done between April of this year and April of 2022. Basically do the fill and finish facility. And Prof mentioned this, of course it will be a start. Looking at the longer term plan to have a fully fledged human vaccine production facility that will take us till May 2023. Then phase 3 is envisioned to go till 2024, whereby we'll move now to the next step of research and development. So in terms of budgets, the cost of this whole project is about 6.4 billion. So far, government has been able to resource mobilize 2.5 billion. So there's still a deficit gap of 3.9 billion. So this is an opportunity to bring in more partners to ensure that we achieve the targeted project. Next slide. Next slide. Yeah, so I think I mentioned that. So as we said, we'll start with the fill and finish. Again, a vaccine production facility needs a lot of infrastructure to be put in place. So we'll start with the fill and finish, even as we look at the longer term plan to have a fully fledged production facility that will have the bulk antigen production. Next slide. So in terms of cost drivers for the project, there are many, they're heavy, but with the goodwill we have, I think we should be able to do something as a country. And as mentioned by previous speakers, Kenya is a serious economic hub in the region, so we can leverage on that. So there needs to be physical infrastructure in terms of refurbishment and other infrastructure we need. Then we also need to put in mechanical, electrical, heating, ventilation, and air conditioning works. Again, there are things like clean rooms that we need, so those need to be put in place. Procurement of production and support equipment for the production, the construction works, procurement of R&D specific equipment, and of course the human resource. We may not have the expertise now, but we are looking to collaborating with other institutions and ensure that we have technology transfer to people who will be employed by the same project. Next. And remember, even in addition to the manufacturing, the gain to the country, there is the issue of job creation, in addition to the other benefits I had mentioned. So we need to make sure that even that capacity is that we may import for a while, we need to transfer it to clients. So in terms of the project implementation status, I mentioned about the feasibility report that was done in 2020. So there's a project committee already appointed, and they had shared the institutions represented. So this committee from the feasibility study said that the project is viable, therefore can be implemented. And I've shared the phases that we'll go through to ensure that we get to the end of it. Then I also mentioned about the concept note that they worked on, looking at what is required to have the facility, issues of budget, who will be involved, how the implementation will be done. And the Kenya Biovax Institute Limited, as mentioned earlier, has been incorporated. And that's the vehicle that we'll use to ensure that we produce the COVID vaccine. Next slide. The facility site has been identified. It is in Embakasi, and already there are ongoing construction works on the same. And then there are already 2 potential partners in facility design, and the non-disclosure agreements have been signed. But of course, it is an opportunity for others to get on board. Remember, once a project starts, there are things that end up being, there are variations, you may need more financing, so it's an opportunity for others to hop onto the bus. Next slide. In terms of potential areas of project support, as mentioned, it is financial, it is technical support, and then issues of education and training. Of course, this is continuous. As much as we may do the initial trainings, we need to continue, because even as we look at production of other vaccines, we need to ensure that we have the expertise. Then, of course, administrative and logistical support, human resource management, issues of digitization, distribution, all those are costs that we need to look at, and their potential areas of project support. Next. So thank you very much.
Thank you, Daktari. A big applause for Daktari. So now we go on to Q&A. Do we have any questions received?
Thank you. There were some questions and comments as well on the online team. Maybe you can sample a few. Just to begin with, this I think is a tough one. Why are we spending more financial resources on Cuban doctors and leaving our Kenyan doctors jobless? There's a comment, great presentation, a very good point about the importance of multi-sector coordination and engagement. There's also a question on, is the feasibility report for the vaccine production project stroke implementation publicly available? And the final comment here from Joy, thank you for the forum, great presentation is done. We clearly have the right ideas and have the right people. There's a follow-up question here. My question is, who takes responsibility for implementation? Yes, so we have those 3 that we can talk about.
Okay. Thank you. So the first one, why are we spending more financial resources on Cuban doctors and leaving our Kenyan doctors jobless? I don't know who would take that one, because I think that's a question for the employer and policy question, I think. I don't know if any of the speakers can attempt. I don't want to pin anyone down on that, because we just want to appreciate that we don't have the employer on the but please feel free.
So thank you for that question. I think the Cuban doctors is a political decision that was made to bring them in, but I don't think it was actually informed by the actual needs in the market. Because if you get the audit report that is yet to be released in terms of the performance of the first batch of Cuban doctors who came, then it will be laid bare that the impact that they had in the sector was very minimal. And that's why we still believe that a Kenyan trained medical officer in this region is better placed to actually provide that services at 1/10 of the cost and save us a lot of money, and in terms of ensuring that there's quality delivery health for our people, then we should quickly move and absorb the more than 2,000 doctors, their pharmacists there, their dentists, and their nurses, instead of exporting them into the health system. Thank you.
Thank you, Dr. Were, for those remarks. We have a question on, is the feasibility report for the vaccine production project / implementation publicly available? This is from Dr. William Witty, and then we have, maybe you can respond to that one, Dr.
So the report is publicly available. It was endorsed by the Ministry of Health. So it is available for reference.
Okay, where can one go look to find it?
Let me find out whether it is on our website, but it is available.
All right. So once you confirm, you inform ourselves as KHF, we will also be able to share it accordingly. Thank you for that. The next one is from Joy. Thank you for the forum. Great presentations done. We clearly have the right ideas and have the right people. My question is, who takes responsibility for implementation? But sorry, I think that's to you again, Dr. Gathitu.
Definitely the Ministry of Health, but of course there's collaboration of other partners that we are working with towards having the manufacturing plant in place.
Thank you. Do you have any other questions? Okay, there's one more question at the back.
Good morning, everyone. Very interesting presentations. My name is Leah Mwai, and I'm from the British High Commission, working for the UK FCDO. I just wanted to ask a question, actually, to Dr. Matilu Mwau, as well as to Eunice, and I think also Louis. One of the things when I've read, reports about this very inspiring and interesting initiatives about us moving to manufacturing is about the question of capability. And one of the things, and I've seen, that's been touched on about knowledge transfer, but one of the questions I have, in all the discussions I've had, I've not really had a lot about the role of academia and how we are training our doctors, in universities, but also some of the work. I'm very interested as someone who represents a development partner. There's a lot of resources that are put into, fellowships and capacity building. And I'm asking this as somebody also who came out of, medical school, and I can see that the kind of skills that that will be required for this kind of profession are very different from what was on the curriculum, and even in the way that, I would say the model of training, because that curriculum was more focused on delivery of care, etc., etc. So I'd just like to understand what is the position of academia in this? What would we be talking about in terms of how differently should we be thinking about training these healthcare professionals and to be more responsive to the needs of a very different, I would say, ecosystem or market? Over.
Thank you, Dr. Gathitu, Dr. Mashogu, and Dr. Were, if you have also a perspective, we would appreciate to hear from you. Unfortunately, Professor Matilu had to leave, but I think you're very synchronized with what is happening in Kansas City as well. So if you can make some comments, that would be appreciated. Thank you.
Thank you, Dr. Moy, for the question. I think even as you look at this venture as Ministry of Health and as a country, we'll definitely change how we have been operating. So manufacturing in Kenya for vaccine has not happened before. We have done a lot of other formulations, but as we look at the issue of vaccine production, now that has implications on other things, including academia. So the team that worked on the feasibility study included some academic institutions, and we shall definitely look at what we need to change in terms of training and capacity building. Because even as we move in terms of technology, or even as we build our economy as Kenya, we need to do things differently. So it is an opportunity to look at the supply side of healthcare workers and training, and incorporate what we'll get from this project. So I think that is a worthwhile thought to have, and we hope to keep building on that. And actually, the focus should be a lot of the multidisciplinary aspect, because we find many times we focus on certain capacity building, certain cadres, and leaving out others. But this is something that needs a lot of collaborations, even as we look at different training, different universities. So it will be an opportunity for us to change that.
Thank you, Dr. Gathitu. Dr. Mashogu?
Yeah, thank you, Dr. Mwai, for that question. So I mean, I'll also tie it up with the question on, so all these nice thoughts, who then moves with them? Yeah. Up to now, I know there've been conversations around curriculum review, especially in the schools of the medical schools, pharmacy, dentistry. You know, even as we jump into the bandwagon for vaccines, there's the bandwagon. You know, the world has moved on to biogenomics. You know, so are we going to take 10 years again to wait for that, even as others then shed off vaccines for us, Africa, to manufacture? So it takes me then to the point of, can we then have the multisectoral sort of conversations? It's good that ministry is having conversations with some universities, but also as the market. Yeah, can we also be involved, maybe through a platform like KHF, and that, so that there's always succession planning. You know, we are going into a new election, so we want to compound the ideas we have as we move. I think that's why we lose it when there's Vision 2030 comes in, another government comes in, and we shed off, you know, with its own new ideas. So how do we then integrate those? We are speaking the same way.
Thank you, Dr. Were.
Yep. Well, I think the Minister of Health, actually, when I referred to it's a JICA-funded needs assessment of what the market needs, and I think that report has not been implemented to the letter. So I think we can use that as a starting point, and I think what is key is to ensure that we involve all stakeholders. So as the ministry looks at this, then also sit down with the experts so that we can tell you what is changing also worldwide as we interact with other organizations, so that we can come up with a plan. Because as I mentioned earlier, there's no need for someone who has qualified to go to university for you to continue training them now at a bachelor level in a skill that very soon is going to be obsolete, instead of wasting that resource. And these young people can be redirected now to train to respond to the new realities in the health sector. And now that you're using more technology, the issue of the vaccines now is coming here, manufacturing, biomedical engineers, we can properly guide these youth so that they're able actually to respond to the needs that the market requires. Okay.
Asante sana, Daktari. Dr. Frank, and then we will take a few more. We have close to 5 minutes over time, so we will be closing very shortly. So, Dr. Frank.
Thank you very much. Yeah, so, I mean, I was bound to say something when we started talking about training, obviously. Yeah, so I look at it in two ways. So there's a pre-service training, which my colleagues have talked about, you know, very early in terms of preparing the next generation, you know, to go through different training. When I was trained as an undergraduate student, some of the molecules that were being introduced to and the industry were being prepared for is very different from the current industry. So that has to be responsive. But I'd like to emphasize in-service training. So there's a lot of initiatives that are taking place around beefing up manufacturing vaccine, COVID and COVID, as you're transitioning from Gavi, but also looking at expanding our local production of complex molecules and R&D. I think what needs to happen is, and the ministry needs to lead this, Eunice, I think you understand this really well, a proper training needs assessment. So you really, once you've mapped out everything that we need to do, we need to look at the capacities and where we have gaps. That has to be extremely objective, and it has to be detailed to the level of expertise that is needed, and then come up with a proper plan on how to plug this in the short term, which basically means, you know, as Dr. Lewis says, bringing some of, you know, the football stadia here in Kenya, bring some of the expertise in the short term to help with the transfer. In the midterm, start bringing some of those people who, including Africans who are in the diaspora, they're doing a lot of these things, find ways of bringing them back here. But in the long term, because we changed our pre-service training, then we actually have more and more people coming through. And it might even make sense to have some of those training facilities available locally as a way of crowding in some of the expertise, because one of the biggest challenges that we have, and a lot of us have been, loosely speaking, returning residents, when we finished our studies abroad, it was always a challenge trying to think about what am I going to do when I come back home. So we have a lot of very good expertise out there, and if you can lay the infrastructure and convince them that you're coming to be part of this change, then we actually have a lot of people can help us in the in the short to mid-term, even as we prepare for the future. But the training needs and the proper characterization of what is needed in the market is the first thing. And this has to include technical pharma biotech expertise, but also other expertise, including managing these types of facilities, managing people, and bringing in clinical research trials. So it's an entire ecosystem that we need to build, but we first of all need to know the gaps.
Thank you. In the spirit of PPC, I think we probably also, private sector needs to have a discussion and dialogue with the ministry, also providing those propositions. I know they have thought through them. Well, sorry, not I know, but I imagine they may have thought through them. But until we speak and have a dialogue, and then fill in those gaps, I think that's something that we should drive. I think this partnership is important, that we also go to the government and tell them these are your thoughts. How can we co-create something or build on what is already existing? So thank you for that, Frank. Yes, Dr. Karanja. And then I will just read the final questions and then we close it. Thank you.
Okay. So thank you. I think I just want to speak very briefly on two key issues. First one is capability. Do you have the capability to do vaccine manufacturing? Do you have the capability for R&D? Yes, we do. And I think the way to look at that question is, when we talk of academia, KEMRI is academia. We are one of the most renowned, yes, we do research. Academia teaches and does research. Academia generates new knowledge. And I think if you look at Africa and you ask, where does the expertise for health research stand? You'll find South Africa, number 2 would be Kenya. And then if you look at the depth and the capacity we have within this country, when you start adding the others, University of Nairobi, CAVI, we go to AMPAC, all these other institutions that are part of this infrastructure, we really do punch way above our weight. The issue, however, is how do we translate research into products? So what has been lacking is the business of the science. So that is a critical issue. So in terms of capability, we shouldn't be worried. The second one I wanted to speak to is for both the CONSA and the BioVac vaccine initiatives. I fear when I see us having a do-it-alone attitude or mentality as we get into this. And the reason is very simple. As a domestic market, we're not big enough. So we know we need at least East Africa to start thinking of, can we break even? We'll probably need COMESA, SADC, the whole African continent, start thinking of profitability. Now, what we need is to be able to attract smart money. And one of the things that, again, I've been privileged to be party of is looking at an initiative that's thinking of how can we have a global aggregator funding mechanism that speaks to local capacity for not just manufacturing, but even innovative R&D and innovative products coming through that entire pipeline. And the reason we need to be able to adopt this kind of thinking is because if we try to do it alone, what's going to happen is we're going to have a loss-making facility. Second thing is the export market that we're talking about, they're still receiving Gavi. They're getting for free. Why would they buy from Kenya? So we do need to align with the donor community because they are actually the market, that the hidden market behind the market that we see. When we talk of the TASCA, yes, there is TASCA, true, but if you look at who pays in TASCA, it's going to be Global Fund, UNICEF, so on and so forth. So how do you ensure that whatever we're doing, actually from conceptualization, is actually part of the supply chain of these actual players? And so how do we mobilize smart money? So it's not just money we need money that's aligned with the African health investment space. So I'll stop there. And I'm happy to just kind of say, let's really stop thinking Kenya, we can do this alone. Yes, we can build it, but will they come? No.
Thank you, Dr. You know the things they don't teach you in Harvard School. Smart money, we really, again, those are things, capacity building, those are things that we need, you call it in service. Those are things we need to make sure that we're all at the same level so we'll be able to mobilize that resources in our own organizations and as a platform. So that's an opportunity area. I know it's your area of expertise, and we would look forward to having a session where you can actually, explain to entrepreneurs and all of us what is that money, where can I get it, how can I get it, and also how do I effectively spend it and make it. Is it a brand or whatever it is, yeah? We have a lot of opportunities that I hope in the next year or so we can actually upskill, the people in the health space, because everyone else is, the skills, the people skills with everyone else. But for us in health sector, I think beyond health, we need those extra skills. So thank you for that. So I will read the other questions that have come up, and then you will allow me to hand it to Marani to talk about this partnership, and then we can go for tea and come back for the session. So the next question is a very noble idea, setting up human vaccine production in Kenya. We pray that the Hydra head of corruption and political interference will not bedevil us. I'm a veterinarian surgeon, and I know that there have been challenges for heavy vaccine. Then we have for Dr. Gathitu, great presentation. Quick question: how is local commercial sector manufacturers involved in the local vaccine efforts? Since we are aware of some domestic manufacturers work on elaborate plans to commence doing this. Thank you, SBS and KHF, for an excellent health symposium and also open fences. And the more you need to really, talk about open fences and how the partnership building up so that at least we know what are we gearing up to. And then this is from Shem. Hi, morning moderators and panelists, and invited conversation platform of the Healthcare Summit annual conference. Good day. Today, good presentations to jumpstart health issues. Then from Chris Masila, and is the Kenya Biovax a PPP or a government-led institution? Just to understand the commercialization model. And finally, we have Revito Healthcare, which is exporting AD syringes globally and recently got investment from the Foundation is a great Kenyan story. So a lot of great things happening there. So I will just ask the speakers, you address your questions, and then Marani, you can take it on, then we'll hand it back to Hans, our host. Thank you.
Sorry, the first question, the Canadian that was asked, I've forgotten what it was.
So there was one of about, there have been challenges in just basically asking that we hope the issue of corruption and will not be developed. I think that one is general. Then the next one is, this is specific for you, is how is local commercial sector manufacturers involved in these local vaccines efforts? Since we are aware of some domestic manufacturers work on elaborate plans to commence doing this. Yeah,
So as mentioned, there are a lot of discussions and engagements with various partners. Federation of Kenya Pharmaceutical Manufacturers, of course, are one of the umbrella bodies that we have engaged severally as MOH. And we are hoping that even as you continue the discussions and looking at the gaps we need to address, even to put these production plant in place, then we'll keep. I mean, there are opportunities for engagement with them. A lot of the products that the local manufacturers are doing are used in the region, not so much within Kenya, but a lot in EAC and even beyond. So we are hoping that given this opportunity to have local manufacture of the vaccine, that we shall find ways of leveraging it. And then the issue of BioVac, in terms of the financing and the ownership, I think it is more of a PPP, but remember there are still many discussions going on. So depending on the partners you're able to get on board, then we'll be able to define it further over time.
Thank you. Do you have any additional comments from the panelists? All right, so thank you. Please give them a big round of applause. Thank you very much.
Thank you very much to all our panelists for a very interesting morning. Now just to kind of like close, I started off by talking about what we discussed yesterday. And one of the questions that actually remained hanging at the end of yesterday's presentation was, what is wrong with the ecosystem? Yeah? I gave the example of the tongue depressor. And you were given a quote that a tongue depressor is a big toothpick. How come we're not manufacturing our own tongue depressors? Yeah? And the question that remained hanging was, there is something within the ecosystem that is actually hanging. Yeah? And today, as we went into the details, we started noticing some of the challenges that are resulting in those inefficiencies. Dr. Machogu, you have pointed out that we do have the manufacturing capacity. 50% of our manufacturing capacity in pharmaceuticals is hanging. Dr. Were has pointed out that we actually do have the human resources required to actually get this work done. Eunice, sorry, I'm using the first name, we go a long way back, shows that we have the regulatory and governance capacity to actually get this work done. Professor Matildo has actually showed us that we actually have the intellectual firepower to actually get this work also done. Now, what is the issue? The issue is that the entire ecosystem does not seem to be talking to each other. That's what this collaboration here intends to do. Strathmore Business School, you'll forgive me, I remember I can have to say the premier business school in Kenya, yeah, wants to bring the intellectual rigor required to actually get the entire ecosystem talking to each other. We had one question about where is academia? Now this is where academia will come in. Look at the numbers, crunch the numbers, look at our ecosystem, figure out where the challenges are, what Dr. Frank was saying, actually tell us which kind of doctor do we need? Where do we need them? Which kind of scientists do we need? Where do we train them? What kind of modality of training them do we need? The second player in this collaboration is the Kenya Healthcare Federation, which is the apex body for the private sector as a board member to KEPSA, Kenya Private Sector Association, and it brings together all the non-state actors in healthcare. And they will be here joining in the conversation so that there's a link between them, policy, and academia. The third player is Open Fences. Now, Fences stands for Public-Private Healthcare Engagement and Collaboration Enhanced Through Science. Fences will be playing the role of the honest broker, who's going to broker the collaboration between academia, non-state actors, and government. And also, if you look, you also have the development sector. Those four are the four legs of the chair that hold the healthcare ecosystem. And therefore, Fences will act as the mat on top of that chair to make sure that when you sit on it, it's actually comfortable. Yeah? You're going to play the role of the honest broker. And starting next year, we want to take this conversation down to the ground. How do we have this kind of conversation at county level so that nurse-led facility at Navajo has a say on what is their pain points, and then collating that information and those ideas to regional forums. We are planning to hold these regional forums through the economic blocks under the Council of Governors. Subsequent to that, at the end of next year, 1 year from now, we want then to have our second National Healthcare Summit, which will be a summation of all the information we have gathered all the way from the ground up, catalyzing the conversation between the private sector, development sector, government, all the way down up. At the same time, we also want to catalyze the conversation horizontally between the players here, Pharmaceutical Association of Kenya, figuring out how do we get, one of the things we learned as we were preparing for this conference was that one of the biggest challenges that scientists in Africa actually face, and Kenya specifically was actually mentioned, is that you do the basic research, then what? So you have all these wonderful test kits that have been developed at Cambridge, and they're just sitting there. Yet Machogu is here saying 50% of our manufacturing capacity is lying idle. So we also want to catalyze that conversation horizontally at all the levels, local, county, we can call it intergovernmental, as well as the national. So that's what this collaboration is hoping to do over the next coming 12 months. And we hope that with that conversation started, we'll start seeing the ecosystem becoming more and more efficient as time goes by. And with that, I'd like to hand over back to our master scientist.